I'm Dr. Mark Bishara. We're in the Paragon Plastic Surgery Center here in North Texas. Today we're going to demonstrate some injections of the temporal area. In a lot of patients over time, you tend to see the old theory. Val Lambros has done some really good aging face videos, and we've all demonstrated them very well. I just came back from UCLA last weekend, and we looked at some of the actual bony changes, and you're not seeing as many bony changes as we had appreciated before in the past. You're seeing more soft tissue changes. Well, here in this area, you got the temporalis fascia and some of the muscles that are below it, and what you tend to see over time is that you see some hollowing out. And so this can be something that happens with estrogen fluctuations as we age. It can be from UVA exposure, or it can be just genetically the way that you were born. You could have this a little bit earlier on. So I'm here with Hannah. Hannah's one of our nurses, and she's going to help assist today. We've put some benzocaine, tetracaine, and lidocaine for an anesthetic on this area, and we're just going over this area. And I like to use a couple passes of good old-fashioned alcohol. I'm not a big fan of chlorhexidine in the face for a lot of different reasons, and for hibiclins, of course, that many people know, but I like just good old-fashioned alcohol. So we're going to use a couple things. We're going to start off by using some filler in this area, and we're going to use one of the biologic fillers. Okay, that filler is called Radiesse, or calcium hydroxyapatite. There's different ways to pronounce that, but I like to say apatite. And so this is a product that gets replaced by collagen over the course of about 2 to about 14 weeks, and it will usually last, the CT scan studies will show, radiology studies will show about 28% of it are present at 1 year. So about a year to a year and a half duration. Today we're going to split both areas. We're going to split one syringe between both sides, but we're also going to use a little bit of neurotoxin. Smile real big for me. Can you do that? So you can see she has some so-called crow's feet. And what I like to do is the FDA recommended dose of about 12.5 units in this. That should take us out to somewhere between about 4 to 6 months of duration. So we're going to do a little 5-point injection technique. Just before we do that, Angela, why don't you put some ice on that for about 5 seconds or so. Ice causes vasoconstriction, makes the blood vessels a lot smaller, so they become less of a target with my needle to create a bruise, but also it makes it much easier to tolerate from a pain perception. So let's start off by doing a little 5-point injection technique. Can you smile real big for me? Good. So you see a little pinch here, not too bad. Excellent. And then second one. And we're just going to put a very, very light amount in each side. Now I'm using 4 cc's to 100 cc's of, or excuse me, 4 cc's to 100 cc's of dilution, or 100 units rather. So for every cc I have 25 units. So that's 12.5 cc's, and I do it in a 3-point injection technique, and I follow that with a little 2 just behind it. Now, let's see, let's switch sides. We're going to do the other side really quickly. Smile real big for me. And she has a little bit different presentation. She has a few more wrinkles on that right side, but we're going to inject her with the same amount on both sides. Smile real big for me one more time. Good. So we've got all that makeup off. We're not having any problems with that. Does that hurt you, Angela? I mean, it pinches a little bit, right?
Yeah, it's not bad.
Not too bad. Okay, and then we're going to go with 2 right behind that. And a little bit there. Excellent. Okay. So that's 25 units of botulism toxin, okay, or also called Botox. So we also inject neurotoxins like Xeomin and other and Dysport. Let's see, I'm going to look at you, and I'm seeing a little bit more volume loss. Really, I mean, you're really pretty symmetrical, but probably just a tad more, a smidgen more volume loss really on this side. So we'll start off over here, and we're going to go back and forth just a minute to fix that. So you see the superior orbital rim as it kind of comes down. You'll see just behind it, you'll see a little bit of volume deficiency. Now you don't have any problems with any nerves that are over here. The facial branch is going to come up, and it's going to be a little bit further away. Your supratrochlear nerve is more medial, and then of course your supraorbital nerve is going to be way over here. So you don't have to worry about hitting any kind of nerve and really any kind of important vascular structure. So really we're going to stay right in here, and we're going to do a deep injection. We're right on the periosteum. We're going to give them about a point 0.2 to 0.3. It's about 0.2. You'll see that kind of nicely elevate. You see that kind of go away. Okay, so we're going to lift that up. Now, from the anterior posterior view, or from straight on, you're going to see that it looks like you elevated her lateral brow by doing this. Now we can go into the brow itself and elevate it, but she really doesn't have very much brow ptosis laterally. She has a little bit of brow ptosis medially, and that could be elevated by doing a little forehead lift, or playing around with some of the fillers, and doing a little if you do a little Botox and micro droplets along the actual brow itself, that tends to let the brow expand, and the appearance is that it will kind of lift up. So just letting that, talking about something else and letting that kind of evolve, you can kind of already see that her volumes, Angela's volumes, are really looking good. Okay, so that's about half the syringe. And what I'm going to do is I'm going to switch places with Hannah. If you see a little kind of vessel that kind of bumps up like that, if you just put a little pressure on it, we can actually put a little pressure on these, and in about 60 seconds or so. Angela always gets a bruise, don't you? Mm-hmm. Yeah, you're always a bruiser. So we can always fix those pretty well. So take a look with the camera. If you can show her that, we could show this. Let's actually see you looking straight on, and you'll be able to see this volume that's been reconstituted. And it's subtle right now, but over the next course of about 30 minutes or so, you'll begin to see that it looks even more profound. But you see the differences in both sides. Okay, lay your head back for me, and we'll put a little ice over this area just to initiate a little bit of vasoconstriction. And you get that out of the way. And let's take a look. Okay, so here we're going to go right at the, just lateral to the arch of the brow, and we'll put in about 0.3. Now this can be done with Bellafill. You can use any polymethyl methacrylate. We hate the word permanent fillers, but we also use the word long-term, or long duration fillers these days. We're kind of away from the term permanent. I wouldn't recommend really injecting anything permanent into somebody's face. So, and that's that. So we'll see if we can get some follow-up pictures on the website or on the blog, or maybe at the bottom of this page in a day or two, and show you how things look. Thanks for tuning in.